This mini talk is on keeping exercise safe. On the agenda, we will be going through muscle versus heart-related symptoms and how to identify and manage heart-related discomfort known as angina. Discomfort and or pain in the chest, shoulder, back, and or jaw could be associated with muscle-related or a heart-related concern. It is very difficult to tell the difference. When symptoms are associated with the heart, we refer to them as angina. Always let your doctor know if you have any new or worsening symptoms. Over the next few slides, we will discuss some simple tips to help you identify the difference between muscle and heart-related symptoms. Muscle-related symptoms increase when you push or rub on the area. Think about a muscle or joint injury you may have had in the past. How did that area feel? For most, muscle-related symptoms can be pinpointed and are described as sore, achy, burning, tingling, or an occasional sharp pain. A good checklist to run through when having these types of pains are to try pushing or rubbing on the area that is sore. If the soreness or pain is replicated when you rub or push on the area, it is likely muscle related. Try changing your body position, such as lifting the arm, tilting the chin, or bending to the side. If your pain increases or decreases when you change positions, it is likely muscle related. Finally, ask yourself when you last exercised or if you did something that may have caused you muscle soreness, such as yard work. If you did resistance training recently, you could experience muscle-related soreness for 24 to 48 hours afterwards. This is especially common for those who are just starting resistance training or for those who are not consistent with their resistance training. There are some other reasons for discomfort that are neither heart-related or muscle-related. Stress or anxiety may cause a dull, aching pain, increased muscle tension, or possible stomach-related issues. If stress or anxiety is causing you any symptoms, it is important to follow up with your doctor. Lastly, indigestion or heartburn can sometimes mimic heart-related symptoms. If you're experiencing indigestion or heartburn, ask yourself, do you have a history of indigestion or heartburn? Did you do something to provoke the heartburn? Is the heartburn relieved with typical measures? If you do not have a history of indigestion or heartburn, or the symptoms are not typical for you or are worsening, it is best to seek medical assistance. Heart-related symptoms are typically referred to as angina. These symptoms occur when the heart muscle is not receiving enough oxygen-rich blood. These symptoms typically last for minutes rather than seconds. People who have angina may describe the pain as squeezing, heaviness, discomfort, or burning. They may also complain of symptoms that include indigestion, heartburn, weakness, sweating, nauseousness, cramping, and shortness of breath. An important note is that pain may persist despite rest or may even occur during rest or sleep. Some triggers that can bring on heart-related symptoms may include cold or hot weather, eating too much before exercise, exercising too vigorously, or not warming up or cooling down properly. Unfortunately, you could also experience no symptoms at all. Communication regarding these related symptoms are important with your exercise therapist and with your doctor or cardiologist. To prevent or reduce heart-related symptoms, consider these tips. Avoid heavy meals or overeating, especially before exercise. When you eat a lot of food at once, the stomach expands and the body shifts blood from the heart to the digestive system. Avoid exercising in extreme hot or cold temperatures. For more information on exercising in hot or cold weather, check out the weekly education section on our website, www.gethearthealthy.ca. Always warm up at the beginning of exercise and cool down at the end. Each should be roughly 5 to 10 minutes. You can warm up by walking slowly or marching on the spot, or if you're using a piece of equipment like a bike, just go slowly at a reduced intensity for 5 to 10 minutes. The importance of a warm up allows the blood vessels in your body to dilate or get wider, which increases blood and oxygen supply. A cool down is just as important to help return the body to the resting level. If heart-related symptoms occur with exercise or while doing something vigorous like climbing a flight of stairs, you want to slow down for 1 to 2 minutes. If your symptoms persist, sit down and rest for 1 to 2 minutes. Ask yourself if your symptoms are reducing, staying the same, or progressing. If your symptoms are not resolved with 1 to 2 minutes of rest, and you are not prescribed or have with you nitroglycerin spray, call 911. If prescribed, always carry and take your nitroglycerin spray as prescribed by your doctor. Some people with known heart disease may have been told by their doctor that they need to take nitroglycerin regularly. If this is the case, it is important to follow these guidelines. If you're not sure if your symptoms are heart-related or muscle-related and they're persisting or getting worse, always call 911. So to summarize, I want you to think of one thing you may have learned from this presentation. You may have learned that muscle-related symptoms and heart-related symptoms sometimes feel the same, and heart-related symptoms are referred to as angina. Always follow guidelines for managing and reducing angina-like symptoms, and always discuss symptoms with your exercise therapist and doctor. For more information, speak to your exercise therapist, speak to your family doctor, cardiologist, or pharmacist, and attend the core education sessions, Exercise and Vascular Health, and Understanding Heart Medications. Thank you.